Welcome to StayAtHome Connect. I'm Phyllis Jackson.
75% of the nation now seeing new cases in the United States, extremely high numbers in Kentucky, Ohio, and Florida, among others. El Paso, Texas, seeing so many patients in its hospitals and intensive care units, they've imposed a curfew to try and reduce the transmission. To Illinois, where the state's public health director became emotional while sharing specifics of the COVID-19 update.
Since yesterday, we lost an additional 31 lives for a total of 9,418 deaths. These are people who started with us in 2020 and won't be with us at the Thanksgiving table. Today, we are reporting 3,874 new cases for a total of 33 confirmed cases since the start of this pandemic. Excuse me, please.
Dr. Ngozi Ezike turns her back to the cameras to compose herself after sharing the news. She's begging residents to take the virus seriously. Here at home, COVID cases on the rise, along with concerns about a twindemic, a combination of flu and coronavirus. Doctors are seeing a shortage of the high-dose flu vaccine throughout metro Atlanta. Now, this is the one given to those 65 years of age and older. Georgia's not alone. Minnesota, Massachusetts, and New York also seeing limited supply. Antiviral drug Remdesivir becomes the first in the U.S. to get FDA approval for use in the treatment of COVID-19. Emory infectious disease expert Dr. Anish Mehta is the principal investigator for the Remdesivir trial at Emory. 103 patients took part in the study, and in fact was the leading enrolling site for the research. He says the approval represents an important step forward in treatment for those suffering from the virus.
Remdesivir reduced recovery time to 10 days compared to 15 days in the patients that did not receive Remdesivir. While the study was not designed and powered to evaluate mortality, Remdesivir did have an interesting trend in reducing mortality from 11.9% in those patients who did not receive Remdesivir to 6.7% in those who did.
Dr. Mehta says Remdesivir also decreased the time in which patients needed oxygen. The intravenous drug is authorized for hospitalized patients 12 years of age and older. It was granted emergency use authorization back in May. You might remember this is one of the medications used to treat the president when he contracted the virus. Atlanta City Council member Cleta Winslow co-hosts a community food giveaway at the Cathedral of Faith Church of God in Christ and World Visions.
That's a wrap. We'll see you on the next edition of Stay at Home Connect.